Hello everyone and welcome to Module 10. It's crazy to think we are just now one short week away from the end of the quarter, and I know that this is probably a topic some of you have been excited about learning and not so excited about learning all at the same time. So this week we're going to focus on phlebotomy, blood collection, and capillary punctures. With that being said, we are focusing on two chapters this week, Chapter 44 and Chapter 47. And I'm going to go in reverse order. I'm going to talk about Chapter 47 first, and then flip it back around to Chapter 44. So hang tight as we get into this awesome discussion on phlebotomy. So Chapter 47 is focused on phlebotomy and blood collection. So you may hear me throughout the video say either phlebotomy or venipuncture, but please know that those terms are used interchangeably and they mean exactly the same thing. So when we talk about blood collection, we're talking about making a tiny incision into a patient's vein, and this is typically done with what we call a hollow needle. That's actually how we collect blood for phlebotomy. So when we're talking about phlebotomy, it's important to know what your role is as a medical assistant during this procedure. Your role will be to completely and properly collect samples, label the samples, process them, possibly depending on the size of the lab that you have, and or store the specimens for transport. Now, in order for you to actually have good phlebotomy skills, you have to have a basic understanding of a few things. Those would be your phlebotomy equipment, your circulatory system, asepsis, and the venipuncture procedure itself. So we're going to go ahead and break into this, but the only one I'm not going to talk about is asepsis. If you can remember back to weeks 2 and 3, we were actually talking about surgical and medical asepsis during those. So I'm not going to revisit those topics. If you want to do so, you are more than welcome by reading your chapter. I just will not discuss it during the video. All right, so to start off this conversation, we're going to start talking about your circulatory system. And it's important to understand this system because it talks about the basics, your heart, blood vessels, and blood itself. The heart is the main organ of our body, and its main job is to keep the heart pumping and to keep blood pumping and moving throughout your entire body. Your blood vessels have a very important job, and that is to provide a one-way travel route around the body and then back to the heart. So really what it's doing is just circulating your blood throughout your entire body and picking up other things along the way. Now, there are some key players that help to move this process along with blood vessels. Those are your arteries, capillaries, and veins. Arteries are what blood will leave the heart from. So from your heart, blood will leave through arteries, and arteries are thick and they have elastic walls, which feel more like kind of a hard plasticky feeling, and they carry blood that is bright red. Arteries also have a pulse, which makes them easy to distinguish between a vein. Next, we have capillaries, and they kind of act as like the gas station for your body and for your blood. They fuel your blood or give it oxygen that is delivered from your arterial blood, and then the cells will get the garbage or the carbon dioxide, and their job is to kind of remove that from the body. Now, once it hits the gas station, it will switch from coming from your arteries, and it will go into your veins. Veins are the ones that carry blood back to the heart, but first they will stop at the lungs, and they will deliver that carbon dioxide so we can breathe that out, and we get supplied with a new form of oxygen at that time. Veins have thinner walls, and they feel very spongy, kind of like a trampoline. The blood that is found within your veins is almost like a darker blood, and it almost has a bluish tint to it until you actually see it hit the air and receive that oxygen again. With your phlebotomy equipment, there is a wide variety of equipment that we use for phlebotomy procedures depending on which one you are performing. But a few things will be the same. Things like your blood collection tubes. These are also called evacuated blood tubes, and they're designed to automatically draw the exact amount of blood that is needed for testing. They have a little vacuum on the inside that once it's full, it stops receiving blood. Each tube color is coordinated according to the anticoagulant or additive found within it. Blood collection tubes can either be plastic or glass, but more often than not, you're going to see plastic ones because they're both safer for you as the medical assistant and for the patient. You're going to have double-ended needles, which is what you see in this picture here. These are double-ended needles. That means that there's a needle on each end, one that will actually puncture the patient, which is this side, and one that will puncture a tube, which is this side. Typically, most of your needles that you're going to be using for phlebotomy are going to be a 20 to 21 gauge needle. Then we also have tourniquets, which are these elastic bands right here that we place onto the patient's arm. They typically are placed about 2 to 3 inches above the puncture site, and they can only stay on for a minimum of 60 seconds. You cannot go anywhere past 60 seconds because it actually starts to have a bad effect on the sample itself. Next, you have your tube holders, which are these guys here. Tube holders are plastic devices placed at the end of a double-sided needle to hold the tube in place. So this item here will actually go onto this end of the needle, so that way it will hold that tube while you're collecting blood. Now, you can also draw back with syringes, and just like giving any sort of injection, they're the same thing. They come in all different sizes and shapes. Typically anywhere from 5 to 20 milliliters are what we'll use for blood draws. All right, getting into the nitty-gritty now, we're going to talk about the actual procedure itself. The procedure can be performed in several areas of the body, but the most common would be what we call the antecubital space, or the bend in your elbow. There are 3 main veins that we use for this procedure: your median cubital, cephalic, and basilic. The median cubital is the most popular because it is the largest. Typically found right in the middle of your antecubital space, it is the most anchored in your body, and it will be the best one for this procedure. The cephalic vein is the second most common. It's not nearly as large, but it is better anchored than your basilic vein. It's found on the outer edge or the thumb side of your antecubital space. And lastly is the basilic vein. Now this is the one you want to use as a last resort option. It's not well anchored, and it's right above your brachial artery. So if you go in too deep, you will actually nick that artery, which is not a good thing. This vein is located on the inside edge or the pinky side of your antecubital space. So now that we know where this procedure takes place, let's discuss the different types of venipuncture procedures. The first one we have is your vacuum tube method. This is also called the vacuum tube method. It's the most common because it allows for multiple samples to be obtained at the same time without having to do multiple sticks. The vacuum in the tube is set to take the exact amount of sample needed for this, and then it will stop filling. So this is the one that you're going to use most frequently whenever you go into the field. Next, we have our butterfly method, and this method is what we also call a winged infusion method. It's a needle that attaches to tubing, and that tubing then has a tube holder at the other end. This is great for using on small veins that are difficult to draw from, specifically elderly or children, and it gives a little bit more freedom with having the ability to use both hands instead of just one. And the last one is your syringe method. This method is used to collect samples from small fragile veins that cannot stand the pressure of the evacuated tube method. The drawback method is the exact amount of blood that you need can fill the syringes, and then you would transfer it to tubes. So when you're using any of these methods, you need to make sure that you're following the correct order of draw. It is extremely important. The reason is that it prevents cross-contamination between the tubes with either skin bacteria or other additives. The correct order of draw is a yellow tube or blood culture bottles, then light blue tops, red tops, and marbles or tiger tops, green, light green, lavender, pink or white, gray, and dark blue. The last thing I want to discuss for this chapter is the capillary puncture. This is also called a skin puncture, and it is used when a very small amount of blood is needed. The appropriate sites for adults are typically the middle or ring finger on either hand, but preferably your non-dominant. When you use these fingers, you want to use the outer fatty edges. Now, you can also use the earlobe, or for children, we typically use the heels. But for the most part, you're going to use those third and fourth digits on the hands. There are two types of collection devices for capillary punctures. One is a capillary tube. The other is a microtainer tube. Capillary tubes are designed to pull blood into the opening of the tube. They can be glass or plastic again. Any that are blue-tipped typically mean that they have no additive in the tube, where a red-tip one typically means it has heparin to prevent clotting. Microtainer tubes are just simply smaller versions of your vacutainer tubes, and they only need a small amount of blood again. All right, so chapter 44 is talking about the clinical lab, and it's helpful to know that it's not only the physician, but the patients who are providing information to you. It's important that you know this information to give to them. So the clinical lab is a way to screen for diseases, to confirm a condition, to rule out a condition, to establish a baseline for medications, to monitor the effectiveness of a medication, and to assess the progress of a disease. Now, labs typically fall into two categories. They're either qualitative or quantitative. Qualitative means that you're going to get a positive or negative result. For example, your quantitative, you're going to get a numerical value or a reference range. It's also important to discuss and understand some of the important lab regulations. The first important regulation or amendment that you need to know about is CLIA, or the Clinical Laboratory Improvement Act of 1988. It was created to protect patients by creating safety policies and procedures. The amendment addresses the issues of quality control, quality assurance, record keeping, and qualifications of the personnel performing the testing. It establishes standards to ensure the test accuracy, reliability, and timeliness of results. And the regulation consists of 4 sets of rules. They are lab standards, user and application fees, procedures for enforcement, and approval from accredited programs. All labs have to be registered with CLIA in order to make themselves an actual laboratory. Another amendment that you need to know about is OSHA, but again, I'm not going to go into this topic because we've talked about OSHA for several weeks now. I know in lab and here in the lecture, so I'm going to go ahead and move past that. Now, the final thing that I want to talk about is understanding quality assurance and quality control. Quality assurance is, as a medical assistant, you are responsible for carrying out the procedures that involve planned and systematic activities to ensure requirements are met and results are accurate. Quality assurance will and should include quality control, orientation, documentation of controls, maintenance checks, required calibrations on instruments, temperature checks, checking of expiration dates on test kits, and proficiency testing. Quality assurance also developed what we call reference values or normal values. Quality control is focused on the physical proof of results that are accurate. This is done by performing mock tests and checking them. All right, that is all I really have for you guys. I hope you have a great week 10,